Today I want to discuss ultrasound findings of the polycystic ovarian syndromes, usually called PCOS. PCOS is the most frequent endocrine problems in women of reproductive age. It occurs in 5 to 10% of women of reproductive age. It was originally referred to as Stein-Leventhal syndrome. It is one of the leading causes of subfertility. Polycystic ovaries etiology is not known, but it is believed to be partially genetic. Patients with PCOS are often obese and have insulin resistance, type 2 diabetes, and high cholesterol levels. To diagnose, there are three criteria. One is clinical, biochemical, and ultrasound. Clinical, the patient will suffer from amenorrhea, oligomenorrhea, hirsutism, acne, and obesity. While on biochemical examinations, there will be elevated androgens, especially the testosterone, and other endocrine imbalances may be present. On ultrasound, often the ovaries are enlarged with small peripheral follicles and echogenic central stroma. We will discuss the ultrasound findings. In polycystic ovarian syndrome, an ovary will contain 12 follicles per image. This criteria is called Rotterdam criteria. The follicles range in size between 2 and 9 millimeter. So it is not more than 9 millimeter in diameter. And a dominant follicle is not usually present. The central stroma may be echogenic. This is a polycystic ovary. You see there are multiple small follicles which are lying in the periphery, and the stroma is enlarged, echogenic, and preserved. There is no follicle in the stroma. This is another one, multiple follicles in the periphery, and there is no follicle in the stroma, which is echogenic and enlarged. In differential diagnosis, first of all, the patients who are taking oral contraceptive should be considered. These women taking birth control pills will have numerous arrested follicles within the ovaries. These are usually larger and distributed throughout the entire ovary. The second most important differential diagnosis is the ovarian torsion. The ovary is edematous and enlarged, and that is due to the edema with peripheral follicles. On color and spectral tracing, there is no identifiable blood flow, and patients with torsions are actually symptomatic with severe pain. So it is very easy to be differentiated from PCOS. Take home message from this small video is that the peripheral follicles have been described as strings of pearls. Ultrasound criteria for PCOS is 12 or more follicles per ovary on one image. And often the intervening ovarian stroma is echogenic. The tiny peripheral follicles seen in polycystic ovaries may be too small to separate from each other. The tiny peripheral cysts can appear as a hypoechoic peripheral region. PCOS appearing ovaries can be seen in normal patients without clinical and biochemical evidence of the diseases. PCOS ovaries may be normal in size It is the abnormal appearance of the ovary that is seen with PCOS. So the presence of follicles in the periphery, small follicles in the periphery, and echogenic prominent stroma. There is a tremendous spectrum of involvement of disease. It's mean that it can involve one ovary, it can involve both ovaries, it can be clinically a case of PCOS while not present on ultrasound or biochemically. Thank you very much for watching, and please subscribe.